Pain in the area of the lower angle of the scapula, along the back of the shoulder, forearm, hand, fourth and fifth fingers, as well as on the front surface of the shoulder joint and the lateral surface of the body can occur as a result of problems with the latissimus dorsi muscle. Watch this video to the end and find out the causes of pain, simple tests to determine problems with the latissimus dorsi muscle, exercises for self-elimination of discomfort at home, and useful recommendations for preventing the recurrence of pain. I am Dr. Chernov. Enjoy watching. The latissimus dorsi muscle is a superficial muscle located in the middle and lower back. At the bottom, it is attached to the spinous processes of the lower 6 thoracic and all lumbar vertebrae, to the sacrum and to the iliac crest. Part of the lower fibers of the muscle at the bottom is attached to the lower 3 or 4 ribs. At the top, the latissimus dorsi covers the lower angle of the scapula and attaches to the humerus. The first area of muscle tension or trigger point is in the armpit area. It causes pain in the lower angle of the scapula and the surrounding mid-thoracic region, which extends along the back of the arm and includes the fourth and fifth fingers. The second, less common trigger point is in the middle of the latissimus dorsi. It causes pain along the front of the shoulder joint and the side of the torso. Trigger points in the latissimus dorsi muscle can be activated and cause pain when carrying heavy objects, doing pull-ups, throwing a baseball, playing tennis, swimming, rock climbing, weeding a garden, or trying to hold a heavy object with outstretched arms. Back and arm pain most often appears immediately after completing physical work. Long-term compression of the muscle by a tight bra or body weight during sleep can also activate trigger points and cause characteristic pain. Pain also worsens every time a person sits down in a chair or gets up from it, helping themselves with their hands. If there are problems with the latissimus dorsi muscle, there will be limited mobility, which can be confirmed by the following tests. The first test, raise your arm up, bend it at the elbow, and clasp your head with your hand. Normally, a person can cover at least half of the mouth with the hand, sometimes the entire mouth. If the latissimus dorsi muscle is affected by trigger points, it will be shortened and this function will be unavailable. The hand will be either near the corner of the mouth or even further. Second test. If there are trigger points in the latissimus dorsi and the long head of the triceps, then the person will not be able to fully straighten the arm and press it to the ear on the side of the problem muscle. Third test. A healthy person can reach the spine of the scapula with the hand when placing the hand behind the back. If there are problems with the latissimus dorsi muscle, this function will be unavailable and the hand will be located much lower than the scapula. You can eliminate trigger points in the latissimus dorsi muscle and get rid of pain at home by massaging the muscle area and then stretching it. Take a large massage roller or a 2-liter bottle filled with warm water. Lie down on the mat, turn on your side and place the roller or 2-liter bottle under the armpit area. Massage the edge of the latissimus dorsi muscle for several minutes and look for the most painful areas. Having found such a place, stay there for 30 seconds, then massage the muscle again in dynamic mode. This exercise also helps to massage the nearby teres major muscle. It would also be advisable to work on the area of the triceps brachii, which performs similar functions to the latissimus dorsi muscle and is also often affected by trigger points. Be sure to repeat this exercise on the other side. You can also provide a point massage effect on the trigger point area of the latissimus dorsi muscle using a large massage ball while lying on the floor or standing near a wall. When performing the exercise near a wall, you can use a small massage ball or a tennis ball. Massage the muscle and find the area of greatest pain. Press on it for 30 seconds, maintaining deep breathing through the nose. Perform the exercise in the other direction and move on to stretching the muscle. Since one of the main functions of the latissimus dorsi muscle is to extend the arm at the shoulder joint and abduct the arm, you can stretch the muscle while bending the arm at the shoulder joint and abducting the arm. In a standing or sitting position, raise one arm up and bend it at the elbow, moving the hand behind the head. Grab the elbow of the bent arm with the other hand and pull it to the side. Bend the body to the side, breathe calmly through the nose and hold the final position for 1 minute. Then slowly return to the starting position and repeat the exercise on the other side. This exercise can be combined with the post-isometric relaxation technique. To do this, in the final phase of the exercise, resist the pressure of the hand and tense the latissimus dorsi muscle as you inhale. As you exhale, completely relax the muscle and stretch it even deeper. You can stretch both parts of the latissimus dorsi muscle by doing the exercise in a doorway. Bend the lumbar spine and slowly oscillate your hips forward and backward. Breathe smoothly and deeply through your nose. With every third exhalation, place your hands slightly higher and stretch the muscles even more intensely. You can also stretch the Latissimus Dorsi when performing the exercise on your knees using hand support. Your arms can be straight or bent at the elbows. Holding your hands behind your back and doing a number of yoga exercises such as Adho Mukha Svanasana or Parivarta Janusirsasana also help to achieve a high-quality stretch of the Latissimus Dorsi. Hold the final position for 1 minute. If the exercise is asymmetrical, such as Parivarta Janusirsasana, or similar exercises in which only the right or left part of the Latissimus Dorsi is stretched, be sure to repeat them in the opposite direction. If you find that you have problems with the Latissimus Dorsi, when doing any physical activity, try to avoid overloading the muscle. For example, if you need to get a heavy object from the top shelf, stand on a chair and do not reach for the object from the floor. If you feel pain in the shoulder blade and arm while swimming in the pool, playing volleyball, or doing any other physical activity, stop, give the muscles a rest, and do one of the stretching exercises. When sleeping on your side, place a pillow between your arm and chest to prevent prolonged shortening of the muscle during rest. Adjust the optimal pressure of the bra straps, preventing prolonged compression of the muscles. Thanks for watching this video and subscribing to the channel. I also recommend watching detailed reviews of other muscles in this playlist. Live without pain and be healthy.